And now I want to bring in Kirsten Brecht Baker, who is the co-founder and CEO of Jeannie. She's doing this as part of our Women and Money segment brought to you by USAA. At a time when many people are stuck at home, we have seen a rise in telemedicine and just everything, as is evidenced by our conversation right now. And Kirsten's service basically provides translation services remotely and in person for that matter, for folks who are deaf or who I believe speak other languages as well. So Kirsten, how is your service playing out right now? Where are you seeing the most demand for translation services?
Good afternoon. Thank you so much, Julie. As you mentioned, Jeannie is a mobile platform that connects you to a video call with a live interpreter for on-demand language assistance. So, kind of consider Uber, Lyft, but for interpreters. So for instance, if you're a healthcare provider and you're a native English speaker, you would use Jeannie in a patient meeting when you have a patient who's maybe a Spanish speaker or who's deaf, and you'd use Jeannie to communicate with them and their family to better assess what their symptoms are, to make sure you understand, and that leads to better diagnoses and more successful treatment. So we're seeing, especially in this, crazy time of COVID-19 right now, so many of our clinics and physician customers are just being overrun by different patients coming in, and COVID-19 knows no differentiation between patients and language. So lots of demand for different, languages at the moment.
And presumably your translators, this is a job that they can do from home, right? If they're providing remote translation service. So how many folks do you have on staff there that are providing these kinds of services, and what array of different languages? And I know ASL also you provide. What's the scope there?
So we actually are the only language service provider in the healthcare market that uses the gig economy model. So again, kind of similar to the Ubers, Lyfts as you know them. So our linguists, as we call them, or expert language speakers, are all over the world. They're in actually over 100 countries right now. And as you mentioned, what's really interesting in this time of social distancing is that all of our linguists can work from home. And we've actually seen in the last few weeks a real boost of new interpreters coming online. Now, it's obviously very essential for healthcare that all these linguists go through a very qualifying process of being HIPAA trained. They're medically assessed and certified. They've had experience for years, but they really are using this now as a form of income much more significantly than they used to be.
Where are you seeing the greatest demand for these services?
Well, it used to be that in-person interpreting, you could argue, is the most effective tool in a healthcare environment. But now in-person interpreting is really not a thing in hospitals, clinics, offices, or anywhere. It's not really safe anymore. It's become risky for the interpreter, for the doctor, and for the patient. And so the video remote service for interpreting is really becoming the tool in order to get language help at all. And as you were mentioning earlier, Julie, about the telemed platform, everything is migrating so much to telehealth right now, which I think is a trend that we will see we won't completely return from. We'll continue to go forward. And we're actually able to also integrate into those telehealth platforms, which are really kind of the vehicle right now for doctors and clinics, to talk to their patients.
But do you track what parts of the country where you see the most demand right now? And if you do, where is that?
So there are pockets of the country that have many more non-English or what we call limited English proficiency patients. California, Texas, Florida, and there are other key pockets around the country that are being particularly hit by this and who have much more heightened demand. So we're seeing a lot in the center of the country in Colorado and Kansas as well.
So talk me through a little bit more about exactly how this works. Would it be like we're in a Hangout or a Zoom call or whatever it may be, where you just have multiple people, one person speaks, the other, you see the other person translate, and then, it goes back and forth, just like it would if you had an in-person translator?
Exactly. So you literally, the doctor, the healthcare provider pulls up their handheld or their tablet, they tap a button, and within 30 seconds, they have a live again, medically assessed interpreter on the screen of the phone, and they can use that to pass back and forth with the patient and the family, or walk down the hallway to talk to the family after the patient. And it's like you said, it's really just like a three-way conversation right there in front of you.
Kirsten Brecht Baker is the co-founder and CEO of Jeanie. Thank you so much for joining us. Appreciate it.
Thank you so much for having me today.